Well, started to suffer with arthritis, would be 12 years ago. 10 years ago, I had a hip resurfacing on my right hip, but they did tell me at the time that I also had arthritis on my left hip. And as the years have gone on, that's become more painful. I've got arthritis in my foot. I've had a fusion. But for me, the main problem, although I took painkillers and I could do the stairs and inclines were painful, it was not sleeping at night. I started to wake every night. I took painkillers, but about 3 o'clock in the morning, I would wake up, and that was really, the main problem that I suffered with.
And so, obviously, it was really starting to affect, your lifestyle and.
Oh yeah, the quality of life. It was, I think we all know if you don't get sleep for a few nights, but this it wears you down. So, I was quite happy when they said that the chain program could help. I was keen to have a go.
And what were your thoughts about it when you sort of read the information and it sort of told you that you were going to be cycling every week? Did that sound like something that you wanted to do with your hip?
Well, I'd not cycled for years, and I was actually wary. I thought that cycling would cause me pain or discomfort because obviously your hips are the main joint working when you're cycling, but I was wrong. It was the other area, the saddle area, that produced the discomfort. Yeah.
But that saddle discomfort got better.
It did. Yeah. The team are very good, and they were able to provide a softer saddle, and you get more confident as you do the program, and you stand up, and you can have a little break between going uphill and downhill, and yes. And besides, to be able to get a good night's sleep is worth a little discomfort when you're cycling.
So if that sort of take you into the program then, so you were doing the cycling, but there's also an educational session part. Did you find that part useful?
Oh yes, the question and answer was very good, and there were certain things that you may have felt a little foolish asking, but when there's a group of people, sometimes of a similar age, once they started to ask the questions, then you became more confident and about the diet and the importance of keeping up the exercise and losing weight, of course. And I've managed to lose 3 pounds, but it's a work in progress.
Fantastic, well done. So you thought that the being in a group was really beneficial?
Oh, definitely, because when you're over a certain age and you've got arthritis, just going to a gym, and you can find it intimidating. You think, everyone's going to be super fit and they know what they're doing. But this was a good introduction into exercise and cycling.
And as well as sort of having the sort of reassurance of being in the group, in terms of the education sessions, what other sort of key points did you learn, or did you change your thought process on as we went through the course?
I think it's important that you maintain it. It's no good coming and thinking, oh, this was great, and you're in the group and you're getting the attention of the team. Then it's up to you. You have to, because I'll be honest, I sort of had a break, about 10 days. I swam, but I didn't do any cycling, and it comes back. You have to, you have to put the effort in. But the classic no pain, no gain. But there isn't really any pain, but it's that, that outlook.
And so after the program's finished, do you continue to cycle and exercise now?
Yes, I go to a leisure club, and it's in a hotel. But the cycle I use it's a recliner bike, and I think I have to work a little bit longer on that. I feel more comfortable. I know that I will carry on using the recliner bike, and I'm going to be honest, I can't get on the cycles easily, and I didn't want to keep going to reception to ask the guy or the girl to help me on the bike. So it's better to do some cycling, even though a recliner bike might not be the most efficient. It's better than not doing it.
But you're using it and managing to keep symptoms controlled?
Yeah. It's made a big difference, and not having to take the strong painkillers, because there's all the attendant, I suppose people know who have got arthritis, if you take the strong painkillers, constipation, and it makes you edgy too. I found it makes you irritable if you take the co-codamol too much.
I'm going to ask you a question now about how much you now feel in control of your hip pain.
Oh yes.
How's the program changed the way that you can manage your life and feel in control of your symptoms?
Yes, it has made a difference. I don't just feel like a passive patient. You go to the doctor or you go to the hospital and you have procedures done or you're given drugs. I'm now able to contribute to managing my condition, and it feels pretty good. Yeah, you feel your sense of well-being. You know, you feel more in control.
And so, if you were going to be giving any advice to either yourself or anyone else joining the program before the chain program that perhaps had reservations whether it was going to be the right program for them and they couldn't quite see how it was going to benefit, what message would you give them? Give
it a go, but you have to put the effort in. It won't happen, you know, if you think, oh, you know, if you're nervous, you know, and the team are there to help you. So definitely give it a go. I can endorse it 100%.